Mpox in the coastal city of Swakopmund. The outbreak was confirmed after the country registered its first case in the coastal city. The concerned patient is isolated at the Swakopmund District Hospital and is currently receiving comprehensive treatment. Responding to the outbreak, the ministry has activated surveillance, contact tracing, and response teams to contain the spread of this disease. Additionally, the ministry's Health and Social Services Minister has provided details of the first case, stating that a preliminary investigation links the outbreak to cross-border travel within the Southern African Development Community. Moreover, the identification of other cases is also underway in Swakopmund and the surrounding Erongo region. Now, for this discussion, we're joined by Osanin Taivo. He's a policy and strategic implementation expert, joins us live from Abuja. Thank you very much for joining us again. Good to see you. Now, looking at...
It's always nice to see you.
Thank you very much. And now looking at this news about Mpox, given the rising number of these outbreaks across Africa in 17 countries, is there a coordinated regional strategy or response that's going on right now, and what does it look like?
Okay, currently we have this current situation in terms of the spread of this virus, the Mpox virus, an outbreak in some parts of the Southern African development community. It's actually very important that this is not perfect from travelers coming in and out of the region who are actually traveling from Zambia to other parts of Malawi and Tanzania, and this part of the Southern African development countries, now from Namibia. And these are the things that actually really affect and make this Mpox disease actually spread around the African this region. It's actually very important that there must be some stringent travel policies and stringent travel rules to ensure that each virus is actually contained, at least to a large extent, so that you do not have a more polar situation whereby a lot of people would now start be infected, because these are contact sort of diseases, these are contact sort of viruses that may result in a lot of stresses from undescended families to the external communities and what it is. So it's also very important that the health ministry of the Southern African development countries must take a cohesive position on how best to actually try to ensure that these diseases is actually covered at least to a larger extent. And this is not a responsibility, sole responsibility of Namibia, neither is it sole responsibility of any country that actually feels the outbreak, but it's sole responsibility of all the countries in the Southern African development community, because that is where this Mpox disease is actually thriving right now. And because Africa is a very wonderful place. You have to be very careful, because before we know it now, we start seeing spread to sub-Saharan Africa, some parts of Western Africa, some parts of even Northern Africa, and then it's going to become a kind of an African disease, and even go global if it's not properly considered and it's not properly called. So it's actually very important that this must be nipped in the bud immediately. Find the Namibian ministry as raised an alarm. The patient is already in isolation, taking necessary medical treatment, but it's also very key that other parts of contact must be properly traced, and also those who have worked traveling in and out of the Southern African development region must also be properly tracked to avoid the widespread of this virus beyond where it is.
And furthermore, how can cross-border travel within the Southern African SADC be better managed to prevent spread of any infectious diseases?
So I want to believe that every region and every country has a very stringent medical framework in which every traveler must actually possess. Because first thing must be that we must actually have number one, a show of vaccine for certain viruses like what was done during COVID, that everyone was allowed to travel unless you actually submit your COVID vaccine um, certificate or something like that. And then we must also go through this path as well, ensure that travelers are properly tested, and when any properly tested, we need on the spot results. So we do not have a situation whereby um, travelers and the airport or maybe through land travels and then they are spreading this virus. So there must be a swift response from all the medical teams across this community, that's the SADC. There must also be a swift response from their medical team, and also we need further collaboration from medical personnel, both from the World Health Organization and other parts of the African region, to collaborate effectively to ensure that this is not a situation whereby it goes beyond the norm. Furthermore, it's also very important to understand that because of Mpox virus is not far-fetched from diseases that are connected to some sort of animals that people call wild animals in sort of part of the bush and whatever. So people must be careful on the kind of food they eat, and there must be proper orientation by the ministry as well to galvanize people around, educating them on the need to actually take very precautious health situations to their own to their own good, so that they avoid this kind of viruses and this kind of situation.
And what are the key challenges faced by public health systems in responding to these zoonotic diseases, especially in places of settings with resources limited in parts of Namibia?
Well, the truth of the matter is these zoonotic diseases are not far from one basic thing, which is characterized with appetite, which is poverty, because these zoonotic diseases are seen as the easiest way to actually get some sort of protein, and then people just go into the bush, into the zoo, get some kind of animal for them to actually get as protein for food. And also, so it's not far from the fact that poverty is one of the underlying factors towards this thing. And because it's also another means of making fast money for them, because it's lucrative when you sell these animals, and you sell them, and if they are not properly processed, that's another key factor. If they're not properly processed, it also creates a kind of system that you actually create this kind of diseases. So in the resource of it, not only far from the fact that the health system in African region, in the African region, is also very it's actually below the international standard. Aside from being below the international standard, we cannot take it from the fact that the health workers also are not enough, because today we see a lot of brain drain, people going outside the shores of Africa, going to the likes of America, Europe, to actually talking about the medical practitioners right now, leaving the region of Africa for other parts of the world, and then creating a system that would actually create a gap, a medical gap in the African region. So those are the problems and the challenges that are facing the African region, and even these are not far from the Southern African Development Community as well.
Thank you very much, Osaniyin, for sharing that insight. Please stay with us as we come back to you. Now we stay in the region. The United Nations have stated that the last Ebola patient in the Democratic Republic of the Congo has been released from a treatment center in Kasai region. The World Health Organization, WHO, has said that the patient is the 19th to recover out of 64 total cases recorded since the outbreak was declared in September. They've also added that if no new cases are discovered in the next 42 days, the outbreak will be undeclared. The WHO's Director for Africa, Mohamed Janabi, has stated that the recovery was a remarkable achievement, has given the outbreak began in just 6 days. He has also added that the country's robust response with the support of WHO and partners was pivotal to this achievement. Now for this discussion, we go back to Osaniyin Taivo. He's a policy and strategic implementation expert, joins us live from Abuja. Thank you very much, Osaniyin, for staying with us. Thank you. Now, as we were just talking about, as the international organizations who contribute to these kind of cases and help them, this I can say is a successful case. What do you think, what factors contributed to this containment of Ebola outbreak in particularly Kasai region, and what lessons can be applied for future outbreaks?
Okay, so firstly, I want to commend the Republic of Congo for DRC for their effective help in terms of spread of Ebola. It was recorded that about 64 patients that had contact with Ebola, and I think about 45 were reported dead, and then about 19 has been discharged from the hospital. And this is not far from the fact that there has been a swift response to this virus, and not only that, there has been a very good collaboration with the World Health Organization, who has been monitoring the situation since the past 42 days or thereabouts. And having said that, it is very important to understand that Ebola virus is not something that is just new in the African region, not particularly in the DRC, or it's been existing for almost over a decade right now, or even more than a decade. But this disease keeps on existing at some point in time. So the real question would be that what is the health ministry in DRC doing effectively to avoid the resonance of this disease? Number two is fine after 42 days, if there are no new cases, it could be things to be that Ebola has gone, because it has a window of about 45 days. And so for the past 48 days, there has not been any new reports on any new Ebola virus taken. It is fine. But on the flip side, what is the ministry doing in terms of the country's Ministry of Health doing to avoid a kind of resonance of this kind of virus? 42 days is a long time to tell it. You say, oh, Ebola is gone. And not only that, if you remember, if you check the United Nations, that's the WHO website, and their tracking of this Ebola virus, we realize that there are some cases that are yet to be reported in any medical facilities. They are not reported yet. Some people are even scared in their homes because probably because of fear of isolation, and some of them are even transmitted this disease to close family members and friends. So it's still going to be a bit difficult to actually say that, oh, this is a situation whereby you can actually effectively say that for 3 days from now, you can say Ebola is gone and over in DRC. But one thing is very critical. The fact is that Africa and the World Health Organization must sit down together and think through on how best to cope with. Do we need a vaccine? Do we need proper rotation? Do we need certain drugs to actually put into place? Do we need certain health orientation for citizens? Because the more we go, the more we try to say, oh, okay, the virus is gone, and then it resonates again, and then it's just like a pushback mechanism, and then there's really no final end to this. And this is quite dangerous to the African health system in general. So do we need an Ebola virus vaccine? Because at the long run, this is becoming more of like, the Ebola virus and this other disease, Mpox and other diseases, is becoming more of like, excuse me, it's becoming more of like a situation like HIV and AIDS that are transmitted into the African region and even the global world. So we must take it to the board as soon as we can.
Yes, indeed. They need to sit down with local people and come to a resolution for a long time. Thank you very much.